All right. Next slide, please, Rosie. So for our icebreaker, how many volunteers does your area need to meet the demand from beneficiaries? Or if you had an unlimited number of volunteer candidates and the means to support their training, how many would you want on your team? And as a bonus to this, I'm going to ask, are you anywhere close to that? Do you feel like you're anywhere close to that? If you want to share that. Does anyone want to throw out any ideas or thoughts that you have on this?
Luann, this is Kelly with Senior Services.
Mm-hmm.
I am now down to 10, and ideally we need at least 15 to function. I've lost a couple of my more senior volunteers who just frankly started burning out after years, and then I lost some new folks. What would really be ideal is like during open enrollment, 2 to 3 volunteers per day for coverage.
Yeah. Do you do in-person events, Kelly? During open enrollment?
Yep, we do a ton. Leading up to and during open enrollment. Yep.
And do you have phone counseling as well?
Yep.
Okay.
So some of my more senior volunteers only work from home. They kind of got used to that during COVID. And so I only have 2 senior volunteers, meaning by senior, I mean veteran volunteers who come in, one for about 3 hours on Thursday, maybe more, and the other one for 3 hours on Friday. So I really need more in-office coverage.
Great, thank you. Anyone else?
I'll speak up.
Thanks, Annette.
I see that our need varies by time of year. And generally, our volunteers are a couple days a week, a couple days a month, up until about June, and then it dies down even more during the summer, and then comes September, and everybody's ready to start for open enrollment in the public and start making appointments and stuff. We found that most of our volunteers put in 2 days a week during open enrollment because we had so many people. And oftentimes some were adding additional appointments and times and often doing other things from phone. So we need to come up with a way, I think, that we can focus some of our volunteers as, I'm going to use the term seasonal. They're focused on basic things, starting from, say, probably some refresher training in September and stuff, and focusing all the way through December. We basically did not slow down until January. And even then, while it's not been real busy, we still have been actually appears to be having more clients right now than what's been typical in the past. I'm also in the area where I have at least one client right now one volunteer who I'm hopefully will be coming back, but I know she's also very interested in moving over to the senior patrol in terms of working on fraud issues. So I do think we need probably somewhere between 2 to 4 at least for open enrollment, and probably a couple more as some of our volunteers are starting, I hate the term, but age in place and may not be as available as they have been. I would love some data as to how long your typical volunteers. And what are some of the reasons why they stop volunteering? Is it age and health, or is it lack of interest? Is it exhaustion? Or in some cases, earlier in the history of Island Senior Resources, it was moving out of state to be with grandkids somewhere else in the country. And what interestingly I have found is that many of them, at least 8 of the ones I know who moved out of state, moved into SHIP programs in their new state.
Yeah.
Which I thought was interesting.
We got Laurel from you in the Tri-Cities. you trained Laurel very nicely, and then she moved to the Tri-Cities and she was a volunteer for me. Thank you for that.
Okay, she did get back active. Okay, I knew she took
Well,
off some.
she hasn't been. She had to leave, but yes, she was a counselor for a little while. So yes, I know your pain. We would like that data too. It's really hard, but if you guys do
She was
exit
a
interviews when people resign, that would help and share that information.
Yeah, she
Yeah,
was great, a great
yeah,
volunteer for about 2 years, and all of a sudden was like her husband got transferred, and so
yeah, yeah. So, Annette, how many volunteers do you have now?
um I have 10 if you count the one that's currently on medical leave.
Okay,
I have 7 that are fully certified, ready, active and going, plus the one that's on leave. I've got 2 that are in the process. I think I'm hoping that one of them finishes up this month. Um,
okay,
she's in a different thing where her work kind of interferes with her ability
sure,
to do a lot during open enrollment, but she can do it the rest of the year. So,
sure,
I'm also hoping to try and get a volunteer that speaks Spanish
sure.
because the north end of the island, we have a lot of s- military families where their parents are living with the well, it's maybe a Navy or Marine.
Mm-hmm.
Um, and well, I'm very grateful that we have all of our people in the service and the provide service that they provide our country. I don't feel that we're able to adequately provide the service for their parents at times.
Right, right. Okay. So you guys, everyone remind me to talk about pilfering AARP tax preparers as SHIBA volunteers if we don't talk about it before the end of the session. We have some SHIBA volunteers who do that in they kind of switch those two. But remind me to talk to you about that if it doesn't come up in our conversation. Okay, who else wants to share? Everyone feels like we could always use more for open enrollment, right? Like that it's a different demand in open enrollment.
I'll share.
Thanks,
Um,
Pam.
so let's see. Yep, I'm with ADSWA down in the southwest corner. And that's a good question. How many volunteers do we need to meet the demand from beneficiaries? Because it depends. Yeah, it depends seasonally, and also which needs. So, we've got our like one-on-one counseling for clients, but I know we also want to do a lot more presentations. And like public education, and so we have a handful of volunteers that are interested in that. um, so yeah, now that we're out of open enrollment season, I'd like to kind of bulk up our presenters to get them comfortable and active out in the community doing presentations throughout the year, so that we have a capable and ready team of presenters to go out when
Mhm.
we start getting those calls right before open enrollment, when people panic and they want to know some things about Medicare, and they're panicking. And I haven't had the bandwidth yet to really focus on kind of bringing up a force of presenters. But so that's kind of a need that I'd like to attend to. So, I mean, I dream big, so I'd like to have lots of volunteers everywhere at the ready.
Mhm.
Right now, we have roughly 20 volunteers, including in-kind partners. I couldn't get to the spreadsheet at the moment, um, but we also, as Annette said, we have one, two, three, four, probably 4 or 5 volunteers that are retiring from their retirement gig this year. And they were our kind of core folks. So they were our experts on complex questions, which we're getting more of. We did have one volunteer pass away at the beginning of the year. Um, so it's we have a great team of newer folks coming up, but yeah, the complexity of what they're dealing with is changing, and so it's going to be a challenge without those experienced SHIBA volunteers to kind of share their insights and wisdom that they've collected through the years. So um, I think for me, I want to build our numbers of volunteers to meet the need, but also I don't want to lose quality of, their training, their support, in addition to like the excellent training that they get through OIC. So I want to be able to have them feel comfortable and confident stopping into our offices or knowing how to check out a projector, or this is how you fill out your mileage report, and this is when you turn it in, and this is when you can expect it back, and this is what your stars entry should look like. So many ways of supporting them. Like I'm afraid of getting so big that we lose some of that foundational support that makes people want to keep volunteering. And so I want to maintain a sense of community, because it's not just about the purpose and the job of, sharing Medicare with people, but I think a lot of people volunteer and they stay because of the friendships, because of the sense of community, because of that shared purpose and like working shoulder to shoulder with people who get it, and feeling supported and feeling like they'll have a team member to reach out to if they have a kind of a random question. So um, yeah, I would love to have a huge volunteer team. I'd love to double our team. Um, and also trying to think of how to scale up in that way without losing kind of those opportunities for, building friendships and camaraderie and those things that make people want to keep coming back. So yeah.
I think that was that's one of our hopes behind this, is that we can help you, because it's your local program that keeps the volunteers. That's what they're really volunteering for. They're not volunteering for the Office of the Insurance Commissioner. They are volunteering for ADSWA, for AltQ, for that local sponsor program, for their community, for their neighbors, right? That's what they're volunteering for. And that's what we're hoping that we can help with. You talked about, I liked how you talk, like you're looking for depth of your volunteer program. I really like that, because one of the things that I found as a volunteer coordinator, like when we would recruit people for outreach, and then a lot of times they would go do outreach, right? And they'd start at health fairs talking to people, and then they'd do presentations. And then as they did presentations, they'd be answering questions, and they'd be like, hey, I can be a counselor. They would come in, they'd be like, oh no, there's no way I can do this counseling. No way. But they would be like, they'd end up being some of our like most proficient counselors, because they kind of worked their way into it. And it was great, because a lot of times the people jump right into counseling, they're more technical, they cling on to those little details, right? So they get it right off the bat. The outreach people tend to be more personable, I guess, if you want to say that, right? More outgoing. And it's kind of getting people to each other's spaces. And then you get a real depth in your field of volunteers, that you have more ability to have people cross over and have volunteers do work that you don't have to go out and do all those presentations. Thank you. We probably have time for one more person to share on this, and then we have to move on. So, and yeah, and Tamara shared it in the chat. And yes, one of the things that we do deal with in this program is the loss of our volunteers, right? And that's hard. Edmonds lost a few people. During COVID, we lost volunteers. I was still in Idaho at that time, but it is hard. And that might be something that we can talk about in a future session too, is how we deal with that as a coordinator for our team, and things, how we deal with the adverse situations. That might, if you guys are interested in kind of having a discussion about that, just share it with us. If you guys like these sessions, going forward, we won't be talking about the sessions so much like we have been this time, because this is the first one, right? But if you like these and you want to keep them going, then share your ideas of what you'd like to talk about, because this really is about sharing ideas and talking things through and sharing resources. And we do have a resource sheet that we've started, that if you guys have resources that you like to use on certain topics like volunteer recruiting or management or program management, share them. You can share them in the chat or in the Q&A, and we can get them onto the sheet that we'll share afterwards with the link to the recording. All right. Does anyone else want to share on this, or should we go on to the next one so we have time to get through things?
I'll share really quick. This
Okay,
is
thank
Monica
you.
with AllQ. Currently, right now, I have 22 active advisors. With those 22, I probably have about 4 that are out traveling and about 4 that are on pause right now because they have health issues that come up. So we have an abundance of calls. I don't feel like it did slow down from open enrollment, but we do have a bunch of calls that need support. And these are a little bit more advanced calls where a lot of the volunteers that are volunteering right now are new and they just don't have the experience. They are doing a lot of more in person because they want that community. They want to leave the house. They want to interact with another person. So finding our volunteers that do phone counseling has been a bit more difficult this year. And I think as we're moving forward, we're going to find that more and more. People want to engage and be social. So I totally agree with Pamela on that. And we want to build a community for them to come. We want them to come to AllQ and feel safe and feel supported by our staff. For open enrollment, how many I would love to have probably would be about 40 or 50 volunteers. So nobody is like bogged down with a whole bunch. Now, like what Annette said, seasonal volunteers would be great. And ideally, I think it would be awesome if we got support from OIC for them to take on some counseling, possibly for our area, or provide the sponsors with additional support with money or funding so we could hire somebody part-time to assist with some support. But all of that takes a lot of time. That just doesn't happen overnight. Pamela, you mentioned presentations. What I have been implementing this last year, and it worked really well for me, is I had about 6 new volunteers come on board, and I made it a part of their onboarding for them to attend a presentation, and a local presentation, whether it's, I would prefer for them to be local from us because I want them to see what we do locally. And every single one of them have during open enrollment started presenting, knowing that they have the support from our staff, knowing that they were able to go see one completely done by another volunteer. That has helped me wonders for this year. And I have not done a presentation over a year, and neither has my customer service and outreach specialist, Mike. We put it out there on Sign Up Genius and they are getting filled. So that's wonderful. That worked really well for me. And they learned so much from that when they're first starting on that Welcome to Medicare. Training is awesome. The training is great, but they learn the basics of what we're telling beneficiaries. And it really is working really great for me. So I hope that works well for you all.
That's brilliant, Monica. Thank you. That's a great idea.
And that's why we're here today. Great ideas. Thank you.
Mm-hmm. Mm-hmm. Okay, let's move on. In Idaho, we used to have, before people submitted their application and we took them on as new volunteers, we asked them to attend a workshop, a Welcome to Medicare workshop, and said that they would, that's the information that they would be learning in depth. So then we didn't get through, 20 or 30 hours of training with them and have them bail on us, right? It was very helpful. All right, it lowered our attrition rate.
All right.
Let's go to the next slide. Okay. So let's share one recruitment strategy that has been successful for you in the past.
I'll go real quick. Having the volunteers share their experience as being a volunteer when they are counseling somebody that knows that I've already done a lot of the homework. They invite them and tell their experience of how it is to volunteer and that they are supported. All the good things. I think I've gotten from open enrollment to current day, I've had 6 people that are waiting for me. I've got 3 that will have submitted their application, and I've got 1 I need to call today, and that was from a volunteer sharing their volunteer experience and that they are enjoying helping others.
Thanks, Monica. Anyone else? Bueller?
I think one of the things we need to do is, as we counsel people, if they start asking good questions, is saying, would you be interested in learning more about Medicare? And we are looking for counselors. And that's where at least 3 of mine have come from.
Yeah. Yeah, flattery gets you everywhere. I used to do that too. Like, you seem to like you really have a knack for this. And I see you catching on to this, and I think that you'd be a great counselor. If you are looking for a volunteer gig after you retire, please come talk to me. Yeah. And I'd even put it on the note, like on their confirmation page or something like that, or on the email. Shameless. I was absolutely shameless when I was recruited. Okay. Anyone else want to share an idea? Has anyone done anything like?
I'll do another one. Sorry. This is another one that we've done is a group. So our agency, not only do they have SHIBA, but they have other volunteer programs. And we've done like a group campaign for volunteer recruitment. We do a lot of Facebook campaigns with that as well. We set up a date where they can all listen to our little brief blurb of the opportunity of volunteering. We do articles in the newspaper or any local events. So lots of different ways that we have done it. We're going to try the recruitment strategy again as a group. I'm working with my team. I'm the lead of that, and seeing how that goes. We did that a couple of years ago. We had maybe about 10, and none wanted to be SHIBA, but they all wanted to be the other programs, which is great. So that's one way of trying to recruit people.
It's almost like a self-contained volunteer recruitment fair. Or self-contained volunteer fair. Before COVID, there were lots of volunteer fairs. So if you guys are in areas where you might have like social service professional networks or things like that, right? Like the groups that gather monthly, but sometimes they'll have volunteer fairs. And I've seen a couple of these coming up. I saw a couple of them come up. Well, I got emails on them, honestly, but unfortunately they were in Idaho. But that they're starting to come up again, that they're having them, that different groups are getting together and having a volunteer fair. Those might be a good thing to look at. Okay.
In terms of numbers,
and
I don't want to like monopolize, but in terms of numbers, bringing people in, partnering with OIC actually was, OIC sent out a direct mailer. So for those who are new and you may not have experienced this yet, basically a postcard, a mailer went out to homes within certain zip codes, people within a certain age range, just inviting them to volunteer. And so we had a flood of people that responded to the last campaign where OIC supported us in that way. So they also did like a radio ad. I know in the future they're looking at doing, more social media boosts. I know our agency does, blurbs on social media about volunteering. So, but as far as like bringing in interested people. Those direct mailing campaigns have been amazing as far as
Good.
bringing folks to us that have maybe never heard of us. So
Yeah.
thanks, OIC.
Yeah, that's
Yeah.
great.
And we're not over at Senior Services, Thurston and Mason County. We're not getting that direct mailer campaign until April. So I decided to just go ahead and try it on my own.
Mhm.
So I've ordered those postcard mailers, and I'll talk to our marketing folks and get their mailing list. Since it was so successful last year, I agree with Pamela. It really brought in a lot of interest. So I don't want to wait. Gotta get that going.
That's definitely great to be proactive with it for sure. And
Exactly.
Monica commented in the chat saying that they also use online volunteer websites as well.
Okay. All right.
I would have to get back to you about the success of it, because we're a little bit new to recruiting in some of our areas this year. But along with that direct mailer, I we wanted to prepare for if there is a high volume of calls, if we have a lot of interest coming in. And so we went ahead and preemptively planned a couple of open houses for the different counties and put the information on the mailers. So we're kind of hoping that that will catch a lot of interested people, that they will just drop in, meet us. We'll be able to give brief presentations and talk to everyone. And hopefully that will kind of help us handle the volume. And then I I don't know how exactly how this is going to go, but something I am trying. There have been a few different organizations, clinics, uh, health districts, whatever, county, people from the county that will ask us. I think someone mentioned for presentations for information, it's open enrollment period and they're getting so many questions and they want someone to come in and advise for a day. And so I have been kind of logging that information away and staying in touch with those humans. And my plan is kind of during this recruitment push to reach out to some of them and say, hey, do you have anyone on your staff that you would be interested in training as a SHIBA advisor, and seeing if maybe standing up some advisors in some of those local partner
Mhm.
agencies where they're getting a high volume of calls anyway. I'd
Mhm.
like to look into that. Not sure how successful it will be, but
You can't know unless you try, right?
yeah, we do have one volunteer right now who's been with us for a while, and she does work for the county and in HR, I believe, and helps a lot of their employees with their retirement
Mhm.
as they're nearing that time. And then she also takes like virtual and phone referrals for beneficiaries that call in. So it could be a really great setup if we can pull more on board. And it seems like when I've brought it up um, to a couple of partners, they've been pretty interested because the idea of having the most current information on an
Mhm.
ongoing basis is exciting to them. So that's part of the way I'm pitching it. Hey, we can get you ongoing training and the most current information and materials and whatever for your staff if you'd like to have them trained. So
That's a great
see how that
idea,
goes.
Kelsey. Giving them you're giving them benefits, right?
Yeah,
Yeah.
exactly.
Yeah. Perfect. Yeah.
Help each
Okay.
other out.
Exactly. Reciprocity. Let's
I'll,
go to the next one.
Yeah. All right. So the next question is, what is your process for educating prospective volunteers about the expectation of being a SHIBA counselor, whether that's through group presentations or just written materials that maybe you provide to these volunteers, or just one-on-one or individual discussions that you might have? So what's a way to kind of get them more in the know of what it is to be, what it is to be a SHIBA counselor? Any thoughts on this?
I bet Pamela and I have the same answer to this. Because last year after the campaign, we both had to ditch the one-on-one um, sharing of information and had to set up some Zoom meetings. Am I right? And just make sure that we communicated that. And I have to say, each time a new volunteer doesn't work out for whatever reason, I kind of add to my mental list of, okay, that's something I should have screened for or should have brought up to them, you know, um, about requirements. These are really unicorns that we're going for. They have to be folks with people skills, but also some ability with technology. They have to understand the intricacies of Medicare and yet also be kind, because seniors aren't always good about communicating what they want, what they need, and anyway, so that that's what I do in the beginning is I try to be as open as absolutely possible about the long learning curve, about the skills needed, what the different types of tasks we have. And depending on the interest, I usually do it one-on-one, but I have to do Zoom sometimes.
Great. Thanks so much for sharing. Um, it, that's an interesting take that you had to go over to Zoom, but that makes sense. Like Noreen was saying earlier, just having that more of that one-on-one connection. We're kind of shifting back into that, pre-pandemic kind of situation where people are wanting to be more engaged and wanting to interact. I mean, they want to feel like they belong to something, and not be a part of a group. That's where the sponsorship. So I really like how Noreen had mentioned that earlier. Just they're wanting to volunteer for you and your organization, not necessarily the OIC. So I think that was great. Thanks so much, Kelly. Anyone else?
This is this is Celeste. I send I'll talk to people, but I also send an email out where I go through it that it's gonna take usually a year for you to get up and feeling like you can go solo. And I almost make it out like the Peace Corps. It's the toughest job you'll ever love because it's like I'm just trying to screen. It's like it, some people, the food bank is a great choice for volunteering if that's more kind of, but this is hardcore. So I'm very upfront about that.
Yes.
And if that doesn't scare them off, then it's like, okay, let's go.
Then you got a good one, right? I mean, you got to
Yeah,
be upfront and honest from the get-go for sure,
yeah,
because it does entail a lot.
yeah.
Awesome. Well, thanks so much, Celeste. Anyone else?
King County Solid Ground here. We actually, whenever people first reach out to us, we send them an email with an overview of the SHIBA program, and then we have them fill out a Microsoft Forms that lays out the expectations of the SHIBA volunteer role, including like time commitment, training, tech requirements. Do you have an active insurance license? Some basic questions. And then if that doesn't weed them out, they will reach out again and schedule an interview. And in the first half of the interview, I go over in more detail about the SHIBA program and how we operate, a little bit about the host organization. And then the second half, it's just asking them questions that are supposed to give us a better idea of how good a fit they'll be in the role. We have a question on like conflict management, another one about research, another one about adapting to new tech tools and what strategies you use to learn. So we have gotten feedback that it is kind of intimidating because we have two staff on the call too, so it's almost like a panel interview. But I think it also drives home the point that even though this is a volunteer role, there are aspects of it that require a lot of responsibility and professionalism, and it is a serious commitment. So, and a lot of people have still continued with the onboarding process afterwards. So I think we've gotten some good potential candidates so far. And we're, like the others have said, very transparent upfront about the big time commitment, especially with the training and how long it's going to take. Um, and also just when they can expect to go to trainings. Like it's usually during business hours, which wouldn't work for people who are working full time. So that's what we've done so far. I'll see how it goes this round. I think this is the biggest group of new volunteers we've onboarded. We have about 16, 14, 16 in the pipeline right now. And then another 14 waiting for a chance to schedule an interview. But we only have capacity to train 14 volunteers at a time in terms of mentorship because we only have 14 mentee slots.
Wow, you guys are busy for sure. Yeah. Um, but so it kind of sounds like, there's different forms in which everyone finds their way of being transparent with individuals, whether it's kind of an in-person communication or kind of laying it out in a work or what was Microsoft form and laying out those expectations and having them agree to it prior to even scheduling an interview. So there's really many different ways in which those expectations can be shared out with individuals. So awesome. Anyone else has another way in which they do or in which they educate prospective volunteers?
I do the same as I think Celeste does, and most of them is actually I try to do a one-on-one. If I have a bunch of people, then I will do a group, but it will be in person unless they do not live in our area. Then I will do by Zoom if they're in Whitman County. And if then I would take a drive there, right? I really connect with people in person. I go over the expectations. I talk about our sponsor. I talk about the history of SHIBA and what our volunteers do and how we help the public. And then if they are still staying in the room with me and they want to move forward, then I go and talk about the Medicare. Most of them are Medicare counselors. That they have an interest, I give them a copy of the role description, and I really highlight the idea of the need to have technology, a computer. They need to be technology savvy, and that they, if they are not active, then if they're not, for me, I put limitations on this because I've been finding that if we're not being consistent with them, it takes a lot of work to do this. And we have to, if we don't have somebody that actively is wanting to do it and they need to be, maybe they're struggling or they need to be pushed a little bit, it is a lot more work for me because I have to follow up with them. If I haven't seen them sign up for anything, I'm going to reach out to them. And I communicate that if there is no activity in 90 days, if I've emailed you and phoned you and you've got no response, in 90 days that you will be, I will let you go from the program. That tells me that you do not want to move forward. And people are okay hearing that. I mean, there is an expectation. I'm not going to sit there and hound you for a couple times. I've got other people that need my attention. So I've laid that out the line a little bit more this last couple of recruitments. And it seems to have helped. The ones that are here are ones that want to be here. And so that's just a little thing that I've changed.
That's awesome. Thanks so much for sharing. All right. Well, before I kick it back over to Noreen for the next question, there's some chatter in the feed here about the recruitment and some sites that VCs have used. Look at Carol Ann use Idealist and the UW's Casey's volunteer posting site and social media. So those are volunteer websites or areas where you can post for volunteer recruitment. So, and then AARP, Monica contributed AARP and Idealist as well. So, all right, next slide.
Just really quick, what's your interview process and what questions do you ask? I think we kind of covered this for some of you in the last one, but does anyone have anything that they'd like to add to this? Is there anything that you ask that someone hasn't mentioned yet that you think is really helpful? something I want to share is what we found is that kind of the more upfront and transparent we are, and I think this has been the message, right? Monica talked about like setting those boundaries and expectations and just kind of not trying to pull people along, right? That you're not like pulling them with you, but they want to do this and they're kind of motivated to do this or they're not. And just be like we found like being the most as transparent as we could be and just letting them be. There's always going to be people who start this and you can tell them, it's going to take about 40 to 60 hours of training at least for you to basically be certified, and that you're going to be that we're going to let you counsel on your own, kind of. Do you know what I mean? And however you want to put that, right? That you're going to be certified, and then it's going to be a little bit more time before you're really comfortable and confident doing that. and then there's going to be even more time before you feel like you're an expert at this, or you're ready, that you can deal with just about anything. So being really upfront about that, that's all good. But there's always people who think, oh, that doesn't apply to me. I know this already, or I'm good, right? And then they find out, no, it does apply to them. And it's not what they signed up for. So they're going to leave, right? And you can tell people, we deal with people from all economic backgrounds and all sorts of things. And they're like, that's fine. That's fine. That's fine. But then they get into income screening and low income, and it's like, I'm not comfortable with that. I can't do that. And they might have biases that they didn't realize that they had, and they're going to leave, and that's fine. Okay. There's going to be people who this isn't suitable for, and that's okay. But the more straightforward we can be about this, the less chance we have of having that attrition, that we get to that 30 or 40 hour. Jeanette can talk about this, that we had a volunteer that we were ready to certify, and he quit, and we're pretty sure that it's because he was going to have to deal with low income people, and he thought he was going to be helping people like himself, right? I shudder a little bit sometimes when I hear people saying, oh, this was really hard for me. I can't imagine how it is for people who aren't as smart as I am. Essentially is what they're saying. I mean,
I think you brought
really
up a good point,
directly,
Maureen.
but
You used the term certified several times.
yeah.
I know we used to do that, right? Or I've heard that we did, but we don't really have a certification process.
Well, we're going
now,
back
do
to a
we?
more we're going back to a more formal process, Kelly.
Okay, good.
Yep.
Okay.
Yep. So, and maybe certified isn't the right word, but the essence of it, right? That they're going to have to attain certain steps and go through certain steps too. Yeah. And that's part of the mentoring that Tamara was talking about too. We have like a whole series of things. As we've built up our staff, we've built up capacity to get back to that, to have that more concrete counselor development.
Only if I'm going to be training people or mentoring them in the summer, I'm going to have to learn how to do a rain dance, because I lost one new volunteer to the really good weather last summer. he said, to be honest, it's just beautiful outside and I'm tired of studying.
Yeah.
There's really no way to know just what their
right. And
tolerance level will be. Yeah.
A lot of them get sick. A lot of them have, like, a lot of our people are 65, have old parents, right? And you guys, I'm just being really direct here, and I probably shouldn't be quite so direct, but it's kind of what it boils down to, right? I mean, like me, I'm going to be 63 and my mom is 91. And so if I were I'm a prime candidate for a volunteer, right? Except that I'm still working. But if something were to happen to my mom and I had to take care of her, there I go. I'm done volunteering for a while if my mom breaks her hip and I have to take care of her, right? And this is what happens all the time with our volunteers. Or if I fall and break my hip, there I go for 6 weeks or 6 months, right? Because it takes a long time to recover. And this happens to us all the time. So it's the nature of it. Okay.
Yeah. I think that's a good segue into the next question.
Thanks, Rosie.
Yeah. Which is, what are your biggest challenges with recruiting volunteers? Like Kelly mentioned, it can be something as, like the weather. Um, any other experiences with challenges you've had with recruiting volunteers? And or how you addressed it?
I don't think it's the recruiting part. I think it's really explaining to them what the commitment is.
Ravioli lasagna.
And I guess also maybe just letting them know that they're being supported along the way. I am completely, I am like a mother hen. I do not want them going solo without me knowing that they know their material. And no one's going to know it all, but I need to know that they know how to research it and know where to find the answer, right? And those are all, I think that's the biggest thing. Now, once they're already a counselor, it's the health issues. I've got 3 right now that were just diagnosed with breast cancer. So they're on pause. They're touching bases with me. They're not actively volunteering, but I'm still checking in. Hey, how are you doing? How can I support? Is there anything our agency can do for you? I had a few leave because of our clients that they were challenging clients, and she had one too many and she was done. And that's fair, right? Not everybody, we can only take so much. So I think that's where I'm at. I don't, it's really of just explaining how much of involvement and working with what they are willing to provide to us is where we have to really be flexible on. This is not their job. This is something that they're doing that they want to give back to the community. So finding a way for us to be flexible. I do not have a volunteer that works every single day. I don't have a volunteer that works for, well, other than the shifts we do, the most they do is a 3-hour shift. If they're doing phone counseling, they have 2 referrals that they get. Now, whether they're able to reach them, hopefully, if not, they keep trying 2 or 3 times. But I don't have phone counselors that say they're going to work for 2 hours and continue that. They don't do that. They don't want to do that. They want to have the flexibility to be able to do that. And we are able to, I've been accommodating, it's been working well for me. But would I love to have more that can give me a couple hours? Absolutely. But finding them is a unicorn.
For sure, for sure. Thanks so much for sharing. And Pam added in the chat that she asked prospective volunteers to describe any experience they've had with people whose backgrounds are different than their own, like socioeconomic, cultural, language, identity, etc. So I thought that's a good bit there. Solid Ground has a volunteer that insists on going in every day to old sponsor office. So 7 a.m. to noon. So he's been doing this for 30 years. So I think he would be a unicorn for sure. There are some of those individuals who for sure like to keep busy, and it's part of their routine to, put in X amount of hours or days every week. So yeah. And then Pam also mentioned that also asking what their day-to-day priorities are like ahead of time, so that if they like to travel, any big things that come up, she can make note of those things and let them know that life happens and self-care is important. So reassuring them that as a team, they fill in for each other, and people uh, and feeling about important things. So volunteering should be satisfying and enjoyable and challenging in a good way, and ask for ongoing communication about what they need. All right. Thanks so much for the contributions. Anyone else? I think we'll do 1 or 2 and then move on to the next one.
Hi, Kelsey here with Catholic Charities. I am, my biggest challenge is that I feel pretty confident describing the process and getting them through the process for counseling or advising. But if I have someone who is just interested in tabling or presenting or outreach in the beginning, like we said, there's not necessarily a certification process, and I don't know exactly what kind of information to give them about what that role will look like or exactly what training they're going to need to go through, versus which pieces they maybe don't need. So I get a little bit stuck with the onboarding piece outside of advising. Well, I'm kind of new to the onboarding advisors too, but I think we have that kind of ironed out.
Thanks for sharing, Kelsey. Oh, I think somebody was going to chime in. Or maybe not.
Yeah, that's been ambiguous. There's not clear-cut guidelines, from SHIBA on that right now. So it's been kind of a case-by-case basis, I think, on what people want. I'll be honest with you, with mine, we had with my sponsors, like when you were at Yakima and with Daisy, what we had people do with my sponsors, what we had people do is we had them on board and do the first three scenarios, do basic training in the first three scenario sessions so that they could talk at health fairs. And they would be able to tell people getting started, and they'd be able to talk about Part D and Medicare Advantage plans.
Okay. Would those volunteers typically go through like STARS training or anything on SHIP TA, or do we just kind of give them the minimal? Do they attend CEs?
They do STARS training on the outreach.
Okay.
Yeah.
Wonderful. All right. So I will move us to this next slide. Did you want me to read it, Noreen? Oh.
I'm sorry, Rosie. Have you
Sorry.
found strategies helpful in organizing and managing your volunteers? Anyone have any secret methods?
Our volunteers basically work in one of two areas, and either the north part of the Whidbey or the south part of Whidbey. And one of the things that has tended to work fairly well over time is to let them pretty well create their own schedule. What day works best for them? I have one on the south end that does some volunteering in the morning for a different organization, and then as every Monday is available to help with SHIBA. Another one does some at this on the south end, and then also spends every other Wednesday at the hospital because she wants to make sure that we've got people available there, and that's in the middle of the island. Another one is kind of creating her schedule, and if she's not able to follow through when she wants, she'll come up with some alternate dates far enough in advance that we can schedule it. So given, and then on the north end, they kind of arrange their own schedule as to what works best for them. So for my group, which is not real big, everybody that's actually being involved has a say in what they're doing and what works, and creating a schedule that will work for them. And should something happen, a volunteer recently fell and broke her leg, team members immediately start filling in and helping each other out. And we almost at times refer to our group as siblings.
That's awesome, Annette. It's nice that you have such such self-motivated volunteers that they take that on. Jeanette.
Let's see if this works. Can you hear me?
Yes, we can hear you.
Yay!
Yay.
Save for the headset. So one of the new things that I've implemented with my volunteers is we actually have a Outlook calendar. And so I have their availabilities on the Outlook calendar and can schedule them based on those availabilities. It's really nice to have.
Great, thank you. Like technology can be very helpful, right?
Yes.
A couple of tools that I use is I use an Excel spreadsheet for just the daily managing of. I start it from when I talk with them for an interview to when they submit their application to when they attend basic training to when they start mentoring, like all of the things. And then I also use Sign Up Genius. I schedule our enrollment events and normally do them on Tuesdays and Thursdays for in person. And then we do one offsite location. We do them like in a group setting where we have 3 or 4 volunteers at one time. They get the calendar, the invites for that. They also get the calendar invite or the Sign Up Genius invite for presentations. So I do that in the beginning, or not the beginning of the quarter, but before the quarter starts. So we are ready to go and I know what volunteers are in place and then I can start filling with clients. So that's how I do it. That helps me. And then if I don't see someone volunteer or be active, then they're getting a phone call and an email from me checking in on them.
Thanks, Monica. Jeanette, did you have something to add? Or is your hand just up from before? Okay. Anyone else? Caroline sharing that they have a shared spreadsheet that includes a phone counseling shift schedule, upcoming tabling events and presentations, and in-person partner sites. Most volunteers manage their own schedule pretty well, but she likes having a record that she can easily update if they have a planned absence or need something to cover or need someone to cover. She also has a schedule. She also schedules events on a shared Outlook calendar, and an in-person partner sites manage the scheduling of client sessions themselves. Yeah. Okay. Yeah, Sign Up Genius can be a friend. Okay.
All right. So we have about 9 more minutes. Do we want to do one more or do we want to kind of fast forward towards the end for a final?
Let's fast forward.
Okay. Oh, I think I went. Was this?
Yep.
Was this one of the slides? After this is just the schedule for the rest of the year.
Yeah. So we do have some references coming out about future volunteer recruitment campaigns and mailings, and I think Susie shared this information with you guys in an email, and there's a quick reference guide and video. We just wanted to remind you to check those, the volunteer recruitment tracker and the guide and video that are available. And there's also an update on future volunteer recruitment campaigns and mailings.
Noreen, I'm sorry, did you say we were supposed to get that via email?
I think she sent it via email. Rosie, do you know?
I think she did, yeah, but I don't remember the dates.
Oh, I don't think that I received it.
Okay. We'll check on that.
Yeah.
For the update. I'll check with her before we send the follow-up email for this. Okay.
And I'll go to the next slide, but just a quick reminder for you that you wanted us to remind you about the AARP tax preparers.
Yeah, thank you. So one of the really good resources that we found for SHIBA volunteers, they make great counselors, was AARP tax preparers, because they like to volunteer. They have like people who can do taxes are usually good at picking up Medicare. A lot of people, like I think Monica has several people who are SHIBA volunteers that do AARP taxes during tax season. And so they tend to go really well together because open enrollment is in the fall, right? And once they get through their first tax season. They actually train in the fall, so it overlaps with open enrollment. That can be a little bit of a problem. But if you go poach the ones that are already tax preparers for the next open enrollment season, they only have to do their recertification. So which starts like in December after open enrollment's over. So it can be they can be a really good fit for SHIBA because their primary volunteering for AARP is after our open enrollment is over, after our peak season is over. And they tend to be a good fit, right? So then you have them, they're often occupied when we're a little bit slower in the spring, right? They're off doing taxes, and then they come back and get their refresher, and they're on for the peak season of the fall. So you might want to talk to AARP, your local AARP volunteer tax office program, and see if they would like to collaborate with you, partner with you. And that's one of the other things. That's our next session. We're going to talk about outreach and building partnerships in the April session, since that's kind of health fair and farmers market season, and trying to, some creative ideas for building partnerships. So bring your ideas and thoughts on that. Challenges, struggles, successes, wacky ideas. If you have something, maybe that you've thought of trying, but it might not work in your area, maybe it'll work for someone else. We'll throw them all out there if you guys are good with that. In June, we're going to talk about contracts and work plans. And in August, we're going to talk about getting ready for open enrollment. Of course, we're already getting ready for open enrollment by August generally, right? But we're kind of talking about the final getting ready for open enrollment at our August 5th session. So hopefully you guys found this worthwhile. I was hoping we could take the last moments to share it. If anyone has something that they picked up from today that made it worth their time, or at least made it worth maybe a few minutes of their time, if you want to share that, that'd be awesome. If not, then school's out early. But thank you for your time and for joining us. And we'll see you on April Fool's Day.
There was a question from Kelsey that she put in the Q&A, and I just want to make sure that got answered.
Oh, thank you. I didn't see it.
She asked, I did answer it, but maybe either Caroline or I believe, is it Celeste that does Edmonds, Snohomish County? The question was, what is the beneficiary referral process for sponsors with a large amount of volunteers?
Okay.
I believe Solid Ground and Edmonds Waterfront, I think, has the largest volunteer base, so.
Yeah.
So we just use a spreadsheet for the phone referrals. For our partner sites, they manage the scheduling themselves. So clients would call the partner sites to schedule an appointment, and they have their own ways of handling it. But we have a memorandum of understanding with each of them to outline that process. But for the phone counseling, all of our volunteers have a Solid Ground email, so they have access to our professional Microsoft 365 tools. And then we have a private channel just for the SHIBA team. And we copy and paste all the referrals into a spreadsheet there. And then they have little like drop downs that they can select their name and how many attempts, whether it's still open or closed. That's how we've been doing it for phone and email.
Yeah, we use Teams. We pivoted to that when COVID hit, and we have our grid there with a SHIBA channel on Teams, and so everybody gets an admin's email that they can access Teams with, and so anything from our Gmail or OIC referrals or our phone calls, they all go onto the grid with notes, and then when we've closed it, we put the BCR number or whatever, and then each day I go in and I update it in the morning and I update it in the evening, and I save copies that people can reference back to if they need to.
I'll share on mine. Since we're a state agency, we can't have volunteers go onto our network, so we have to email the referrals out if they're doing phone counseling, and then the majority of them we try to get in person. So we make the appointment and have everything ready for the volunteer when they come in.
Mm. That sounds like a lot of work. Yeah.
It is. Yeah. I don't do that part. So we have a hired person to do with that, but it's a lot. I look at it often, make sure that the calls are being sent out, or if there's one that needs to have staff take a look at it instead of a volunteer, then we scan it, and I normally take those if it's a troubled one that needs a little bit more attention.
Okay. All right.
All right. Thank you so much for joining us today.
Thank you.
Thank you.
Thank you.
Thanks, everyone.
Thank you.
Thank you.
Thank you.
Thanks, y'all. Have a good day.